My name is Joseph Stanford. I'm on the board of directors for the International Institute for Restorative Reproductive Medicine, and I'd like to give you an overview of that organization and our activities, and hopefully encourage you to get involved. I will start with a few key definitions of what we're about, talk about our mission, give you an overview of our meetings, talk about our exciting webinars, talk about the research we're involved in and promoting, and then extend an invitation to get involved. Restorative reproductive medicine is basically medical evaluation and intervention that seeks to restore or cooperate with the normal and healthy function of the human reproductive system. Therefore, it excludes things which are suppressive or destructive or circumventive. So, for example, contraception that suppresses normal reproductive process is excluded. So is in vitro procedures to facilitate conception, because those are not part of the normal functioning. The whole idea of restorative reproductive medicine is to work with and enhance or restore the natural function. Naprotechnology, or natural procreative technology, is a specific type of restorative reproductive medicine, which is based specifically on the Creighton model fertility care system, which is a specific standardized means of monitoring and charting the menstrual cycle or the fertility cycle. So the Creighton model system started as a means of natural family planning and then was extended to include women's health applications and expanded to include medical protocols called natural procreative technology, or naprotechnology, which is basically an approach, a standardized approach for restorative reproductive medicine. So the IRM mission is to advance excellence in restorative reproductive medicine. So the broad spectrum of anything that qualifies as a restorative approach, we're interested in. And we want to do that by supporting practice and research through mentorship, education, and collaboration. We've held a number of meetings since the IRM officially got going with meetings in 2004. Many of them have been in various states of the United States, but we've also held a couple of meetings in Ireland, one in Italy, one in Poland, and one in Canada. Our next meeting will be in Salt Lake City, Utah, here where I am, on the 11th of July in 2012, and that can be attended in person. We'd love to see you, or online. We'd love to see you attend online as well. We've had a very successful webinar series starting in 2011. These webinars are given at least monthly, about 1 to 2 times per month, and have included a number of topics that are listed here, including various topics around polycystic ovarian syndrome, or PCOS, the use of progesterone in pregnancy, bioidentical hormones, thyroid disease in pregnancy, the cervical mucus score, its application, the use of low-dose naltrexone in infertility and pregnancy, male infertility, the diagnosis and treatment of endometriosis, unrecognized pregnancy loss and miscarriage, examining luteal phase defects, whether they're a myth or a reality, and how we address them, ovulation induction, and also just case discussions where we share and review cases, clinical cases. We've had a couple of publications to date, a study out of Ireland in 1998 of naprotechnology for infertility, and just published this year a study out of Canada, again for naprotechnology for infertility and miscarriage. And you can get details and links to those studies on our website, which I will show you in a few slides. We do have some very exciting ongoing research. One of these is the International Naprotechnology Evaluation and Surveillance of Treatment, or called INEST. The core question for the study is, what are the rates of live birth as a main outcome and secondary outcome of preterm birth? Obviously, the lower rates of preterm birth, what we're looking for couples treated with a NAPRO approach for infertility or miscarriage, and also in relation to underlying prognostic factors, age, duration of fertility, prior treatment, and diagnosis. Currently, we have participating practices, clinicians in the United States, Canada, and the United Kingdom, and we hope to add more countries in the near future. Another ongoing study is to look at the biomarkers of fertility, specifically with the standardized charting of the Creighton Model Fertility Care System, and look at how well those observations can distinguish between subfertile and normally fertile women. We propose to work on this out of Canada and are in process with that. Another sponsored study is the Pregnancy Achieving Trial being done in Australia. This is not specifically a NAPRO technology approach, but a related restorative reproductive medicine in looking at women with unexplained or anovulatory subfertility. Do the following interventions increase the likelihood of pregnancy? Asymptothermal charting, luteal phase support with progesterone, and amoxicillin to enhance cervical mucus production. Another study out of Australia is the supporting threatened outcomes with progesterone, or STOP trial. This is women who present with threatened miscarriage and seeing whether progesterone supplementation will decrease the risk of miscarriage or increase the likelihood of a live birth. So I'd like to end with an invitation. If you share our goals and interests, please join us. Everyone is needed: clinicians who are working in this area, researchers who are doing work or want to work in this area, supporters of all types who are interested and support this work. And we are all about international collaboration and learning from each other across different settings and different approaches that all have a common restorative reproductive medicine focus. Our website, you can find us at www.reproductiveinstitute.com. Please do look us up there for the webinars, for membership, for the meetings. And just close with a scene from Utah, which is where I live at the University of Utah. And hope you can visit us here this year or sometime in the future. But more importantly, hope you can join us in work with the IRM in one way or another. Thanks.